Hello and welcome to the home edition of Newsbreak Chats. Ako po si Chai Hofelenia, ang editor ng Newsbreak. Ito ang investigative at in-depth section ng Rappler. This is actually a first in the history of Newsbreak Chats. Dahil nga sa enforced community quarantine, we're forced to do this not in the Rappler headquarters as we would usually do, pero we're doing this from our respective homes. And we're live streaming via Skype. So buti na lang merong technology which allows reporting and pag-uusap na katulad nito kahit na papano, kahit na nakakulong tayo sa sarili-sarili nating bahay. Inevitable for us today to talk about coronavirus. Talagang wala eh. It's very pervasive. Lahat yan ang pinag-uusapan. Yan talaga ang ating concern because it has turned our lives upside down. And it's also testing the agility of both local and national governments worldwide, hindi lang dito sa Pilipinas. So for today, we've actually invited our news editor and 3 reporters to share with you yung mga observations at yung mga importanteng information that we think you should know. Kasi I'm very sure some of you are also tuning out kasi sobra ng daming information and news about the coronavirus. So Gigi Go is our news editor and siya ang nagsusupervise ng aming coverage tungkol sa coronavirus. Hi Gigi!
Hello!
And kasama ni Gigi, ang tatlo nating reporters, magsisimula ako to introduce, medyo kilala nyo na siya eh. Si Rambo Talabong, who has been covering the police. And Rambo, siya rin yung one of those who directed coverage at the early parts nung nag-declare ng lockdown. Hi Rambo!
Hello!
And of course, we have Mara Cepeda, who is covering the house. And for a while, dahil napakagaling ni Mara, kahit saan mo siya ilagay, pwede. Siya rin yung pinatakbo ni Gigi sa Department of Health naman. So, hi Mara.
Hello.
And lastly, last but not the least, we have JC Gotinga. Hi JC. Si JC has been covering defense, but not just defense, kasi nga multitasking talaga. Si JC rin yung sumusubaybay sa Pasig and kay Mayor Vico Soto, among countless others. Hi JC.
Hi, hello po.
Okay, siguro to begin lang, kamusta kayo? Kamusta kayo feeling locked up at home when ang kalakaran dapat nasa field, di ba? Nasa labas. How are you holding out, Gigi?
I guess I'll be speaking for the reporters, including those who are not on this chat. Frustrating for them that they cannot go out after the lockdown started. So, you know, they would express their desire to go to communities to see action firsthand. But I think for some time we will have to observe all the self-quarantine and yeah.
Ikaw, Rambo.
Same sentiments. As in, for the longest time, gusto ko talaga lumabas na ulit. For the past 2 weeks, labas kami ng labas ni na JC at saka ni Mara dahil sinusundan namin yung lockdown, titingnan namin kung ano nangyayari sa labas. Pero at the snap of a finger, at the passage of a memorandum circular of Malacanang overnight, bawal kaming lumabas sa aming barangays, bawal kaming lumabas sa aming mga bahay unless may essentials na kailangang bilhin. So as journalists, talagang we want to speak to people, we want to go out, we want to walk out, we want to go to institutions to talk to people, pero the government itself is telling us na wag muna, medyo delikado kasi kumakalat na talaga ang coronavirus sa bansa.
Mara?
For me, what's really frustrating now is that the government is scrambling. Everybody knows that. Everybody can see that from Luzon to Mindanao. And it's now so difficult to reach out to them because press conferences are now digital. So some of them, we couldn't press them for the issues that we really want to ask them. Mahirap na ring tumisod ng mga officials na all of a sudden may bagong responsibilidad kasi tatawagan mo sila, pwede mo silang i-Viber, pero iba kasi yung personal na i-interviewin mo yung official. Kasi by then, pwede mong madaan sa, parang onting kumbinse na, sige na sir, bigay mo na sa amin yung datos kasi kailangan sa ganito. Ang daming mga restrictions. So it's very frustrating. But at the same time, we're also challenged to really do our best to get everything. But kasi, papagalitan din kami ni Ma'am Chai and Miss GD if we don't get the story. But it's
Hala
very
kayo kay Gigi.
frustrating.
Ay,
And
ganun.
namimiss ko na po maglakad sa labas. It's just one of those things na you take for granted and then suddenly it's taken away from you and then you realize it's really important pala.
Oh, ikaw naman, JC, in your area of the woods, bandang Pasig, di ba?
Yes. Maswerte ako kasi yung mayor ko, media savvy. So, he posts something and he's pretty much reliable naman about what he says. You have ways of verifying, lalo na if you're familiar with the area, yung talaga bang barangay nagpayong yun, alam mo naman na yun, kasi nakapunta ka doon. Pero, as a reporter like Mara said, you feel encumbered or constrained because, for one thing, you don't know what questions to ask then because sometimes the questions come from being on the ground. So when you haven't been on the ground, even if you have a line to the mayors, the other officials, sometimes you don't know if your questions are on target.
Sige. Pero yun, no? Interesting din kasi yung challenge nga is as journalists, parang how do you cover when you're locked up in the four walls of your house or your room, no? Pero I guess ang sabi nga ni, 'di ba, si Maria ito sinasabi niya, crisis always presents opportunities. So maybe this is also an opportunity for journalists to be creative, 'di ba? Okay, Mara, could you put us up to speed lang para lang ano ba yung latest when it comes to the situation on COVID-19, which is the disease, as of latest na alam mo?
Okay, so the latest data that we have on the cases right now is that we have a total of 636. So as expected, dumadami na siya. Let's not be surprised that the number of positive cases are rising because that is also a consequence of the additional testing kits that we're getting from both local and foreign donors. In a way, it's a good thing because now we're getting a full grasp of the extent of the infection. But again, it's still not enough because, for example, other countries in the West, nasa five digits na sila eh. So they're able to capture the extent of the infection better than we are right now. So even if it's alarming, at the same time, we are welcoming it kasi now we have data kasi dati talaga wala tayong datos. Dumadami na rin sadly yung mga fatalities natin. As of today, nasa 38 na siya. But still, our recoveries also are rising. Dumadami na rin. Now they're at 26. But now we're at that point of the outbreak where we are seeing that hospitals are really getting overwhelmed. So earlier, Department of Health Secretary Francisco Duque III gave the go signal for several hospitals, public and private hospitals in the Philippines, to be turned into hospitals exclusive for coronavirus patients.
Is that a good thing?
These are the Dr. Jose Rodriguez Memorial Medical Center and UPPGH. It's a good thing. It's medical professionals are recommending this because nangyayari kasi if we get exposed, diba, to a coronavirus patient, we have to go on quarantine. So the trouble, the reason why hospitals are also turning away suspected cases lang of coronavirus cases is because the moment na ma-expose ka sa isang positive case, then you would have to isolate all the other patients. So kahit yung mga walang coronavirus apektado. So so a lot of our hospitals, several private hospitals actually made an appeal to the government to make these exclusive hospitals. Pero ang nangyayari na rin ngayon, for example, St. Luke's Medical Center and the Medical City in Pasig, sa turf ni JC, hindi na sila makatanggap ng
Mhm.
ibang PUIs kasi overwhelmed na talaga. I think nakakalimutan kasi ng tao na kahit yung mga doktor at yung mga nurse and other frontliners na may expose dun sa positive case, kailangan din nilang mag-quarantine. So that's 14 days where a hospital will lose certain medical professionals.
Right.
Tapos ngayon, obviously, madami tayong pagkukulang sa mga supply. Ang nangyayari, kahit yung mga interns ng hospital, meaning they're not paid, I see them, I do have batchmates who are, interns in several hospitals. They are joining a lot of efforts to make face masks na improvise. May story tayo na ganyan sa Rappler.
Mm-mm.
But ganun pa din, patuloy pa rin yung call out for supplies.
Sige. So apparently, yeah. So talagang on a daily basis, madaming developments, no? But I'm just curious though, meron ba kayong tinatagong worries or fears or concerns? Kasi nga, yes, dumadami yung testing, which is a good thing, and I think we will expect that the numbers will rise exponentially pa, no? Pero yon, ano yung kinakatakot ninyong maaring mangyari or hindi mangyayari?
I'll go first. Because Mara touched on it. I worry about the transmission rate doubling or rising fast. Only because we don't have an idea of what we're up to because of the shortage of test kits and maybe people who would be giving us like sound analysis or interpretation of what's happening. I'm also worried about the LGU's resources getting depleted because they may have emergency funds, but this is like a prolonged emergency. We don't know where this is going to end, and um, much of the burden of implementing the lockdown and giving social support emergency relief to constituents or are put on the shoulders of local governments. I'm also afraid that if LGUs want to do good in their emergency response, they might be restricted by the local government to the point that they will be paralyzed.
Mm-hmm. Have you seen cases of that on the ground?
There are a few, yeah, there are a few incidents we've seen that the Pasig case, of course, that's been largely covered by the media. When Mayor Vico Soto even asked permission. Take note that he didn't just implement it. He was asking permission from the National Task Force if he could at least allow tricycle drivers to operate within the bounds of the city. So to ferry doctors and patients and people who are vulnerable. And immediately the response of Malacanang was parang nagmamagaling ka and you will be threatened by administrative charges. And there was Marikina that planned to conduct testings on at least 3,000 people, but all of a sudden the task force is and yung Malacanang is warning them na no, you cannot just do that. You need permission, you have to go through us. Yung ganon. And these are the mayors that traditionally, by reputation, have been sort of strategic in terms of thinking and mas proactive and innovative.
Yeah.
And nasasampulan na sila. So what else the other mayors who might be thinking of, I want to do something out of the box because this is what I see my constituents need, pero takot na sila ngayon.
Let me jump quickly lang to JC because Gigi mentioned Pasig, no? JC, could you give us a sense of ano ba yung dynamics ng LGU and then yung dynamics din ng Pasig siguro with the national government? Could you, kasi baka hindi lahat din nasundan yung story of Vico in Pasig.
Yes, so as Ma'am Gigi said, no, he wanted to let tricycles have a limited run. Actually, it was through the media na na-air niya yung concern na yun sa national government. The media picked up the story, which is why it came to the president's attention, and the idea was shut down. earlier today I spoke with the transport chief of Pasig, and now they want more guidelines from the national government. Nalinawin yung ano yung pwede namin gawin, alin yung hindi. Because they tried to make an executive decision, they tried to improvise and make the lockdown work in their situation, because si Duterte rin, President Duterte himself said na you guys make it work, you are the local executives, and yet this happened. So medyo in limbo yung pakiramdam nila.
Right. So parang devolve nga sa iyo yung powers, tapos ginamit mo, nag-improvise ka, tapos biglang pipigilan ka.
Nasampulan ka
True,
naman.
true.
So,
Oo.
Pinatahimik
Right.
din.
Oo. Rambo, ikaw, ano pa yung ibang fears mo? Or siguro dahil din sa you've been in touch with Manila and si Mayor Isko Moreno, ano naman yung situation in Manila?
Okay. First, gusto ko po munang sagutin yung tanong nyo na saan ako natatakot.
Yes.
Nakausap ko rin nung linggo si Mayor Joy Belmonte. At ang kinatatakutan ko talaga para sa akin, taga-QC rin kasi ako, ay yung pagkalat ng virus sa mga vulnerable communities. Yung mga high population areas, yung slums, yung jails. Kasi dito sa mga areas na to, wala talagang choice sa mga taong mag-social distancing or physical distancing. Talagang nabubuhay silang magkakadikit sila.
Yes.
At QC na mismo nagsabi na pinuntahan daw nila yung bahay ng mga taong nag-self-quarantine at hindi rin nila ma-enforce. At wala rin sila mga mask. Dahil nga nasa poor communities tong mga to, hindi rin sila makakakuha agad-agad ng face mask, protective equipment, hindi ito accessible sa mga barangay captains nila, sa local officials nila. So kung pumasok man yung virus talaga at mas kumalat pa dito sa communities na to, feeling ko may hirapan talaga ang healthcare system natin, babagsak talaga. Kasi ngayon pa nga lang sinusubukan natin i-contain sa ating mga legitimate hospitals, healthcare institutions. Pero kung sumabog to sa mga informal living areas dito sa slums, I can't imagine kung paano mag-respond ang ating healthcare workers.
Curious lang ako. Meron ba kayong info or nababalitaan na sino bang LGU ang pinakahanda precisely to address that problem? Na kasi 'di ba, anticipating the worst that could happen, and once na as Rambo nga put it, once na sumabog yun doon, once kumalat yun, ang laking problema nun, ang laking social problem, ang laking health issue nun. Meron bang LGU na medyo more or less na defined yung kanilang protocol, workflow, or merong semblance of paghahanda? Or wala?
Yes, Ms. Gigi.
I think sa Metro Manila, no, parang I think it's a given one, the LGUs that have a lot of resources, like Makati. Every time there's a need na lumalabas, meron siyang pang-address the funds, the supplies, but also because it has a good health program in place. Mara has written about this and talked to Mayor Abigail Binay before. And I think Rambo would tell you about how Manila under Isko and his vice president, who is a doctor, is very much prepared to address this. And we've seen again Marcy Teodoro, and I think this is a system inherited from the Fernandos pa before. Decades ago, parang ito a system was put in place that whoever becomes mayor can just improve on that, mas responsive. And Pasig, of course, Vico has been introducing a lot of innovation based on data, consulting with experts.
Pero sa konkreto, I guess yun yung pinupunto ko sa tanong. Parang meron ba silang workflow? Meron ba silang, itong gagawin natin. Once na nabalitaan natin na meron ng pumutok na case sa Payatas or sa Paseco, kung saan man yan, anong gagawin natin?
Meron po akong sinulat na storya dyan kung paano mag-respond ng local government units. Nag-issue ang DILG a month ago, so February ito. Pero this issuance, February, we would think na maaga pa to, pero this is already 2 months after the outbreak in China. So some people would say that it's already late. And February, konti lang yung oras na ibinibigay para sa local government units para makapaghanda. Kaya every time nag-i-interview ako dun sa mga mayors na nakausap ko for the past week, tinatanong ko, kamusta po yung ating BERT, yung Barangay Health Enforcement Emergency Response Team? Ang sinasabi nila, they weren't given enough time. Kasi yung kailangan sa BERT, meron silang isolation rooms, kailangan alam nila yung training nila, pero wala silang magawa dahil isang buwan lang na may nakalipas. Kailangan pang i-train. Tapos meron pa ditong physical things na kailangan talagang itayo tulad ng isolation rooms na wala naman silang meron ng mga barangays na hindi pa maayos ang kanilang barangay hall tapos hihingan mo sila ng isolation room. So itong crisis na ito talaga ang sinasabi din ng mga mayors na nakausap ko ay hindi nila na-imagine. Hindi nila na-imagine na mangyayari ito na up and then yung kanilang pagtingin sa kanilang local governments.
To describe yung sa Pasig, not to say that other LGUs don't have this, but yung nakita ko sa Pasig, on the weekend that it was first reported that we had our first local transmission of the virus, nag-Facebook video si Mayor Soto na meron na silang facility, something like a warehouse, na merong mga isolation tents, and yung the word that comes to mind is yung palanggana, where they will disinfect the response teams. So they have organized and mobilized response teams, and yung response teams na yun may protocols sila anong gagamitin para mangsundo, saan dadalhin kapag kasundo, pagkatapos saan pupunta yung team na nang sundo, kasi sila mismo, of course, they will need to cleanse themselves. So that much we saw, meron silang ganon. And if he was able to show it on video on the weekend that the local transmission was reported, ibig sabihin, he had some lead time of preparation bago naging local. So, I would say that much nagkaroon siya ng foresight kasi it's not months before, but when it happened, when the first local transmission happened, may naipakita siya on video na eto may preparations kami.
Dagdag ko lang po yung sa Manila at saka sa San Juan State, kung magandang mga case studies din. Sa Manila, nakapaghanda rin naman sila, nakakuha sila ng isang floor sa Santa Ana Hospital, ginawa nilang isolation area. This was a month ago din, February, as soon as the DILG issued the memorandum. Pero nakikita natin ngayon ay ang bilis talaga ng pagdami ng mga kaso. Ang napaghandaan lang nila 20 beds. Pero yung pagtaas ng kaso natin, sobrang dami na. Overnight sa Manila, tumaas yung kaso ng 17 cases. So, iniisip na nakapaghanda na rin naman nila kung paano magre-responde, gagawin yung buong hospital na talagang isolation area. Pero the scale of how much this is really expanding, overwhelming para sa kanila. Sa San Juan naman, si Francis Zamora, nakapaghanda naman daw siya, pero ang sabi niya, yung San Juan Medical Center hindi pa siya fully prepared kasi hindi siya maayos na na-construct ng nakaraang administrasyon. Medyo nakalimutan ko nung sinabi sa akin ni Francis Zamora na oo nga no, kaka-elect lang sa kanila. Yung election last year lang, as in a few months ago. So si Francis Zamora of San Juan, nagsesettle in pa rin siya nung sumabog ito.
I can add, I wrote about this in my newsletter in early February that the LGUs in the provinces were parang given the chance to somehow prepare better than Metro Manila. Kasi sila yung, when the outbreak worsened in China, and then there were a lot of Chinese tourists going into the Philippine provinces, sila agad, and while the LGUs were waiting for Malacanang, for the national government to give us specific instructions, they did what they could with what they had. So Aklan, for example, nag-designate na siya ng parang convention center or dating hotel na itong quarantine area natin. And then even without directives from the national, dilimit niya yung movements ng mga Chinese tourists. I think dumating pa nga sa point na merong isang batch na parang apparently this was the flight straight from Wuhan that left Wuhan parang shortly before the lockdown was announced. Tapos nag-land siya sa Aklan, pinabalik ng governor. Parang ganon. So, ngayon din, nabibigyan din sila. I think Bohol also, there are a lot of LGUs in the Visayas that were prepared. And then ngayon, nakakapaghanda din sila because even if the lockdown ordered by the president is only Luzon-wide, they are outside Luzon. Nakita na nila ano yung nagiging problema ng Luzon. So ngayon, nagkakaroon sila ng localized lockdowns in Visayas and Mindanao. And kumbaga somehow, quote-unquote, nakaka-experiment sila, how do we respond? So they have a taste of what would happen if there will be a total lockdown island-wide in Visayas and Mindanao. So,
actually, kasi kanina, no, chinek ko nga yung timeline natin. And kung kunyari LGU ako, mayor ako, tapos I would take my cue from the national government. Mali eh. Kasi talagang napaka-delayed ng reaction even at the national level. So halimbawa, it was only in January 31 na nag-impose ng travel ban ang si Presidente Duterte on the Chinese coming from Hubei. Pagkatapos February 3, meron siyang reassurance na everything is well and nothing to be scared of. So kung mayor ka, nasa probinsya ka, sabi ng Pangulo, everything is well. So cool lang tayo, chill lang tayo, di ba? And then it was only, tapos bigla na nitong Marso, parang ang bilis ng mga pangyayari. March 12, lockdown in Metro Manila, or sige, community quarantine, semantics, di ba? Tapos a few days before lang yung pagdideclare ng public health crisis. So parang talagang, tapos itong Marso, ang daming naganap, ang dami-dami talaga. So I guess my other question is, how prepared is the DOH for this, Mara? Parang kung overwhelming, and yun na nga, there are more test kits that are arriving, tataas ang numbers exponentially, handa ba ang DOH?
They weren't. No. I mean, the trolls are saying no government could have prepared for an outbreak of this scale. That's true. But other countries have shown that you can have the foresight to respond at hindi lang reactionary yung response mo doon. Kasi parang, for example, on the issue of test kits, sobrang init nun ngayon. Ngayon na lang dumadating yung napakaraming donations. Because for the longest time, so I started covering the DOH again about a little over a month ago. And a month ago, pag sinasabi pa ni Secretary Duque is that we're not going to use the rapid diagnostic testing kits that South Korea is using because it's not accredited by the WHO. So, ang nangyayari kasi, there seem to be so tied up with red tape and bureaucracy that suddenly, when the cases and when the infections is spreading everywhere, they realize, oh, we made the wrong call, and now they're really scrambling. For example,
did they really realize that, Mara? Have they really realized that?
Well, we hope they are realizing it. Kasi alam mo, lang lumalabas kasi ang observation ko, once na sobrang na-amplify, for example, yung now kasi yung makukuha natin yung public pulse yung social media, diba? For example, yung issue on quarantine facilities and COVID exclusive hospitals. Nung walang petition na nangyayari, hindi nila sinasagot yung tanong, ini-ignore nila yung mga tanong ng mga reporter. Just today, ngayon, meron ng sinasabi si Yusek Rosette Vergere na meron tayong 2 quarantine facilities for PUMs, persons under monitoring, and persons under investigation for COVID-19. Dapat nung January pa lang meron na tayong ganyan. Ngayon pa lang nila nare-realize. Kasi suddenly they realized, ang dami nating PUMs, ang dami nating PUIs, and actually sabi din ni Secretary Duque, we need to isolate these people kasi they may have mild to moderate symptoms today, but tomorrow it can be severe. So, and tama yung nire-raise ni Rambo, alam naman nila yun. Alam nilang maraming mahihirap na Pilipino na ang bahay ay barong-barong lang at wala silang pera para mag-isolate. So parang 'di ba, alam na 'to ng gobyerno natin bakit ngayon lang tayo nagre-respond? So it's really frustrating because obviously they have people on the ground but they're not responding. Hindi din handa yung
actually yeah. Speaking of yung the numbers, kasi if nabasa nung readers natin yung sinulat ni Tomas Pueyo, ang sabi niya, whatever number we have now, if you should be multiplied by 27. Tapos yun yung actual. So yung ilang hundreds lang natin.
600
ilan tayo?
plus.
600 plus
600
times 27. Magkano yun? Ay, magkano? Ilan yun?
Eto,
Wait, I'm
calculating.
computing. Okay.
600.
Oh no.
Six
Yung mga
hundred.
journalists.
690 around ganyan 670.
Six-
67
Times
times
27.
27. It's more than 18,000.
Okay, close to 20,000. Yan ang actual, according to him, yan ang actual number. So, di ba, if you were DOH, dapat yun yung nasa isip mo na sa totoo, ito yon. This is how huge the problem is. And
And
ito yung problemang isa-solve ko, di ba?
And I just wanna jump in na parang hindi nila na-realize yung scale because now, for example, in Marikina, Mayor Marcy Teodoro actually prepared a laboratory. Meron silang sariling test kits at ayaw ipagamit ng DOH kasi
Yeah.
daw hindi accredited. So doon ako na-frustrate because, you do have really competent local officials already going beyond what the national government has told them to do. Tapos pipigilan mo. And for what? Because of bureaucracy? Because of red tape? Kasi hindi ipinaalam? Parang siguro naman at this point, di ba? Parang bakit mo papipigilan? Well-meaning. And Mayor Marcy just wants to test more people, di ba? Parang, I don't know, there's
Paano
something
kung
wrong with it.
false negative or false positive?
Kasi, well, you have to trust that our elected, our mayors are taking care of their people. They're not going to create a lab that is not vetted properly. Kasi parang alam mo yun, parang na-offend pa ata yung DOH na nag-initiative itong si Mayor Marcy. Parang, di ba, sana chinek na lang, tapos pinabayaan, hindi yung parang may gusot pa sila. And I'm sure yung mga kukunin naman sigurong test kits ay hindi alam mo kung saan-saan lang nila kinukuha. These are test kits that were donated by countries that are already testing people by the thousands.
So wait, good idea ba ang mass testing, JC? What do you think?
I think even if, kasi di ba dalawang klase daw yung tests, isa is to find out the DNA of what virus ails you, as opposed to the rapid test that is reliant on the viral count, which means pag mababa yung count mo, hindi niya mababasa. Pero my opinion on that, opinion ko lang po, is it's better than not knowing. It's better than being blind and not knowing at all kung meron or wala. At least it gives you a better idea. It's like, what would you prefer? Malabo yung mata mo or bulag ka? Okay na yung medyo malabo, but it gives you a semblance of, it gives you a better of idea of the landscape, what's out there. As opposed to, no, we will only stick to this very limited supply of a certain kind of testing kit.
How about data, information, available information, or information that's made available by the government? Ang sense nyo ba ganun ka-transparent ang LGUs at saka ang DOH for that matter? Or meron bang models, halimbawa, sa ibang bansa na pwedeng we could possibly learn from?
Okay, so I think that the national government isn't as transparent with us when it comes to data. But the local government units are more transparent because they know their people more and mas concentrated yung mga taong minomonitor nila. For example, I've in Ilocos Norte, in Ilocos Sur nag-declare na si Governor Ryan Singson na meron silang highly suspected case of COVID-19. This was on Monday. So kahit yung mga local officials in Ilocos Norte, they were already posting on their social media accounts na if you were a passenger of this bus number 25, I think, na bumiyahe mula Manila, Palawag, please contact your government officials or your barangay. May ganong effort. Yung DOH kasi, for example, hindi ko nakikita yan eh. So it's based from my personal experience. So I am under home quarantine right now because I covered a March 11 hearing where a resource person tested positive for COVID-19. But it was only a week later when the House of Representatives started informing the media officially. Of course, we knew about it beforehand, a day before, na Miss Mara, if you were if you attended this hearing where the DOH and our office are tracing it. But can you imagine, 7 araw na akong na-expose. Doon, ang lumipas,
Sa
doon sa
amin.
exposure
Joke.
ko. And then during those 7 days, ayan, nakaharap ko si JC, nakaharap ko si Miss Gigi, si Rambo. I think ikaw, Ma'am Chay, hindi. Di ba parang,
Buti na lang.
di ba? That's the problem. We're not tracing people fast enough. Kasi, in my case, 1 week na bago ako nag-start mag-quarantine. And in that same hearing, nandun si Secretary Duque who only went on quarantine maybe 4 or 5 days after I did. So, di ba, paano kung carriers pala kami? What if we are asymptomatic? And we've already spread the disease, di ba?
And a lot of people are asymptomatic. Anyway.
This is a stark contrast to Singapore, where they even their police investigators were tapped to do contact tracing. And isa yan sa and Singapore is one of the model countries in terms of containing this outbreak. Kasi sinimulan talaga nila na, well, mayaman silang bansa, country. But at the same time, hindi nila in-underestimate yung disease. Very rigorous yung contact tracing. So, is it okay if I share to you a comparison of our tracker and the tracker of Singapore to illustrate it? Sige.
Sige, sure.
Let me pull it up. Okay, hold on. So, what you're seeing right now is the nCoV tracker of the DOH. You see it? I highlighted it. Obviously, tinan nyo ditong cases by health facility. What time is it? It's 7:46 p.m. and it's still currently updating. And yung latest figures natin, nasabi na siya ni Yusek Vergere maybe 2 hours ago. So hindi nila to na-validate ng real time. And then if you makikita mo yung case, the specific details of the case, you click, for example, I click patient 74. Lalabas dito sa may harap yung detalye niya, but we are already at case 636, but patient 74, for validation pa rin yung kanyang nationality, yung residence, at yung travel history of exposure. So it tells you na sobrang bagal, 'di ba? Ang meron lang validated ay yung kanyang age, na female siya. Hold on. Okay, so I was reading pala details of patient 626. So I was clicking patient 74, hindi siya lumalabas. So may error siya, 'di ba?
Yung limited information about each patient, it could be because of our Data Privacy Act that DOH doesn't want to violate, but we can discuss that later. But compared to Singapore, how much information about each patient does Singapore reveal?
Okay, so this is the Singapore page naman. As you can see, sa kanila matatrack mo yung, meron sila ditong graph that will actually show you yung pagtaas ng hospitalized cases. In terms of the patients, click ko si patient. Okay, let's go to patient, case 306. Okay, so medyo nagkaka-problem. Yeah, okay. So, si patient 307, unang tingin, it's more or less the same information that the DOH in the Philippines wants to show. Pero meron kasi silang ganitong feature. You can click, tapos it will direct you to another page that actually shows to you ito yung unique and I think very helpful, the one I'm highlighting, the links between previous cases found. So they are able to show already clusters. So for example, itong for letter A, na-identify na agad na itong mga cases na to ay linked dun sa the Life Church and Mission Singapore. So at
yung connections.
Tapos yung isang cluster umattend naman sa Grace Assembly of God. Dito kasi sa Pilipinas, parang pahirapan pa para malaman kung saan ko kaya ito nakuha dahil ba umattend ako sa ganito. Hindi to ginagawang available ng DOH sa public, but rather they will inform the people who are part of that gathering na you might have been exposed. Yon.
Sige. Ang value naman ito, this is not to say na DOH, ang point lang naman talaga nito is for us to look at models and to see how we could do better. So yung tracking is clearly something na pwedeng gayahin sana, no, sa Singapore. And ano ba kasi ang value ng communication? Kasi parang sasabihin ng iba, nasa crisis na nga tayo. Kayo namang mga journalists, kayo namang mga media, nang hahabol pa kayo at nang kukulit kayo, di ba? Parang kayo kaya dito sa lugar namin. Ganun ang, na-imagine ko, ganun ang thinking, di ba? Pero ano nga ba ang halaga ng sending information out through the media? Rambo?
Talagang ang local officials natin, pinag-aagawan din ng media ngayon kasi sinusubukan nilang ma-reach ang kanilang constituents. Swerte si Manila Mayor Isko Moreno at saka siguro si Mayor Vico Soto na ang laki na ng kanilang following sa kanilang Facebook page. Kaya kung maglalabas man sila ng post, madali nang i-share sa iba, ipagkwentuhan. Pero may mga mayors na hindi naman ginagamit palagi ang kanilang social media accounts. Ang isang nakausap ko dito ay si Mayor Joy Belmonte ng QC, na palagi niyang ginagamit ay ang kanyang personal Facebook, na yung kanyang mga post sa kanyang personal Facebook ay medyo binapatikos siya kasi nakikitang nagre-reklamo siya. Pero kasi nung nagpa-interview siya sa ANC nung linggo, nakita niya na medyo hindi daw siya inintindi na maayos. Kaya nung tinext ko siya, agad naman siya sumagot. Sabi niya, tawagan mo ako, kailangan kong i-explain to lahat. Kasi nga ngayon, sobrang halaga talaga maglabas ng impormasyon na accurate at saka maaasahan. Kaya itong mga mayors on the ground, talagang humahanap sila ng mga makakausap. Tinext ko rin agad si San Juan Mayor Francis Zamora na hindi rin ganun kalaki ang following kahit na meron siyang Facebook ngayon. Sabi niya, kailangan talaga niyang mag-reach ng pinakamaraming tao. At palagi silang humihingi ng tulong sa private sector, humihingi sila ng donations. Kasi nga, nabanggit na rin ni Ms. Gigi ito, na nauubos na rin ang kanilang pondo at hindi nila alam kung kailan matatapos tong krisis na ito.
Ano kasi, no, if you will leave out the media or limit the information that you give to the legitimate media, you're creating a void that can be filled by either noise or disinformation. So anong gusto ng if the government officials would be complaining na bakit makulit ang media, hindi namin kayo maasikaso. Sino ang gusto nyong mag-disseminate ng information na magpa-firefighting pa ang gobyerno kung hahayaan nyo na may disinformation na kumalat instead of giving it to the media para ang media yung mag-interpret for you, mag-translate for you, mag-amplify ng message for you.
JC, you want to add anything?
Si Mayor Soto kasi one point he made that I really appreciated was parang sabi niya, okay lang naman magkopyahan kasi ang Pilipino may culture na this was my idea, so don't use my idea. But he's saying, when I implement something, it doesn't have to be originally my idea. I saw it work in Valenzuela. For instance, nung naglabas siya ng ordinance penalizing hoarding of food and medical supplies, alcohol, ganyan. Nakita daw niya sa Valenzuela yon. So, ginaya na niya. Hindi niya na kailangan mag-isip. Siguro humingi siya ng kopya ng resolution. Tapos, because it's fast, hindi na nila kailangan maging territorial when it comes to that. And one way that they find out, or the whole country finds out what the others are doing, yung quote-unquote best practices, is through the media because we report what's good, we report what's bad, we report what doesn't work and what worked. So, like for instance, what happened kay Mayor Soto na sample lang siya because of tricycles, then already malinaw sa lahat ng LGU sa buong bansa, okay, we don't cross that line. And then it moves the conversation. So ngayon, they're asking, so set guidelines now. Hanggang saan kami? Hanggang saan kayo?
Okay, siguro last question kasi napaka masalimuot talaga nitong issue na to and we can go on and on and on. Siguro looking ahead, no? Parang ano ba yung kailangan pang gawin? Either both at the national level and siguro at the local level kung meron pang mga hindi nagagawa. Tapos isasama ko na rin diyan, I'll weave in a related question na bukod sa looking ahead, ano yung dapat gawin, ano rin yung mga dapat nating iwasan or what should we be watching out for or watching out against, lalo na in this kind of a crisis situation. Rambo, gusto mong mauna?
I think sa akin, nakikita ko, I think a theme in the narrative right now is between the formal steps and improvisation, innovation. Nandito ngayon yung ating mga local government units at saka national government sa punto kung saan hanggang sa natin pwedeng i-bend ang rules para matulungan ang ating taong bayan. Pero dito sa mga pagkakataong ito, makikita rin natin na baka napapasobra, baka mamaya mali talaga yung ginagawa nila, baka napapaabuso yung kanilang paggamit ng batas, yung kanilang pagpaparusa sa mga tao. Meron tayong report na sa Parañaque, yung mga tao pinapabilad sa araw bilang parusa. Sobra na ba yun? O sa tingin ba natin legitimate pa yun para mapigilan pa ang mga tao? Si President Duterte, yung kanyang pag-realign ng budget, is that justified? That also happens sa local level, yung pag-realign nila sa budget nila, yung pag-implement nila sa kanilang ordinances, yung agad-agad nilang pag-implement ng kanilang executive orders, kung hindi man sila kampi sa kanilang council. Merong ganitong kailangang gawin, kailangan hanapin ng local government unit at saka ng national government yung sweet spot kung saan legitimate pa rin yung ginagawa nila, pero it's also innovating because this is a disaster, and in disasters kailangan talaga mag-innovate, maghanap ng paraan para matulungan ng lahat.
Gigi?
Siguro lesson is to listen to for the national government to listen to the frontliners. And by frontliners, I am referring to the medical workers, those in the hospitals, and the local officials who are implementing all the lockdown measures, keeping order on the ground, and also the people who are doing trade and business. Kasi apparently they were the ones who were not consulted when all this lockdown and very draconian measures were announced and implemented. Kaya tayo ngayon nagkakagulo. Para lang malinaw, I don't think anybody opposes the idea of a community quarantine or a partial lockdown. But what happened was it was imposed on us apparently without taking the input, or not, maybe took the input but didn't listen to people who would be actually on the ground to implement that. Kaya tayo nagkakagulo ngayon. Yung for the record, I think the Filipinos gave the DOH and the national government a certain leeway to prepare for this during that time when we were saying, and I remember one of our earliest editorials about this outbreak in China was ganito ang tono na, don't panic. We have DOH protocols in place from what we learned during the SARS outbreak in 2003, and let them just do their work. But during that period when we were trying not to panic and giving them the chance to prepare, nag-slide sila into complacency. So here we are now.
Mara or JC, meron ba kayong concluding thoughts? Or gusto niyo, may mga gusto kayong idagdag?
For me, I think it's important also for our leaders to follow the laws and the policies that they want their constituents to follow. We're recording this NB Chats on March 25, and ang nasa hot seat ngayon ay si Senator Coco Pimentel because he insisted on accompanying his pregnant wife to the Makati Medical Center kasi manganganak si Katrina. And but hindi niya disclose that he was already showing symptoms of COVID-19. He had a 38-degree fever, he had a sore throat, and he already started isolating himself from his wife at home. So the Makati Medical Director, Saturnino Javier, really did not mince words against the senator because by going to the medical city, he possibly infected all of the medical staff of the hospital who now may need to go under quarantine. So kaya galit na galit kasi parang, di ba sir, sinasabi nyo sa amin, number 1, follow the lockdown rules. Number 2, social distancing. Number 3, respect the government. Tapos ikaw hindi mo susundin. Di ba parang, they stopped short, actually the medical Makati Med chief really just stopped short of calling him a hypocrite, but there's a line there where he said that all of Pimentel's statements about doing social distancing are nothing but empty words. So I think it's very important, lalo na for our government officials, to follow it also. Kasi the people will be convinced to trust the government if they can see that the government is also following the rules.
Mhm.
I
JC?
think to connect to what Mara said, we were warned na kasi 'di ba tayong Filipinos, meron tayong feelers kapag it's a military approach, there will be police and military on the streets, and we know how to guard against that. And tama lang 'yon. But what we've seen so far is reports of local executives, barangay captains na opportunists yung naniningil for the quarantine pass. So, yes, let's guard the uniformed servicemen. But also, let's look at the civilian government because kahit sila iffy. Yun. And also clarity from the national government. I think with the late night speeches that we waited for from President Duterte, if I ask
For more
myself,
than 4 hours.
So long.
eh, did I come out more reassured or not? Parang you feel like I should have just gone to bed. So, on that note, Ma'am Chai.
Okay. Thank you very much. Alam nyo, itong nagagawa ng home quarantine, humahaba kami at lumalampas sa oras.
Oh
So
my
yung
God.
30 minutes, umabot ng 50 minutes. Anyway, mahaba pa to, malaking problema ito. Nobody has really prepared any of our leaders, any of our doctors, our hospitals, and even our mayors for a crisis as huge as this. And kahit kaming mga journalists, nangangapa rin, how do we cover something like this from within our homes? Pero sinabi nga na a country will be as strong only as its parts, no? So dito mahalaga na dapat yung LGUs, yung local governments, should also be sufficiently supported by the national government. And the media will also be there disseminating correct information, provided that the DOH, SANA, and even the local governments will be transparent and giving out that information so that everybody will be well informed and will know how to deal with this crisis. So thank you very much for listening to us. Thank you for joining us. Sana sa susunod na Newsbreak Chats, hindi na tayo naka-quarantine.
Yes.
So maraming salamat for joining, and I'm Chai Hofilenya. Enjoy your home quarantine habang meron tayong pandemic, but stay safe. Bye.
Stay safe.